Thank you, Griff. What I'd like to do, let me see if this moves forward here. Can we start the next presentation? Thank you. What I'd like to do is to talk a little bit about obesity and type 2 diabetes from the point of view of insulin resistance. And why insulin resistance? Well, insulin, as you know, of course, is the hormone that controls blood glucose, but also insulin resistance, that is a lack of normal response to insulin, is really at the center of this complex metabolic syndrome that includes obesity and type 2 diabetes, and is really, if not the driving force, a major driving force for many of its components. The first, I guess, point I would like to make is that insulin resistance isn't just part of type 2 diabetes and obesity, but it's really a central component of many of the metabolic derangements of metabolic syndrome. And I've illustrated for you this in this diagram where you can see near the top glucose intolerance and type 2 diabetes as outcomes of insulin resistance. Central obesity is both a cause and an outcome of insulin resistance. Hypertension, essential hypertension, is associated with insulin resistance, and insulin resistance is part of syndromes of dyslipidemia associated with atherosclerosis. So the classic metabolic syndrome, which is sort of the top half of this, are all disorders linked to, in some way, insulin resistance. But there are many other components of metabolic dysregulation which also are insulin resistance related, and some of these are a little less obvious than others. Hepatic steatosis, fatty liver disease, another interest of NIDDK, is another major disorder linked to insulin resistance and is becoming, non-alcoholic fatty liver disease, becoming a leading cause of liver failure in the American population and actually in populations outside of the US as well. This is also linked to a less severe but still important medical problem of cholesterol gallstones. Reproductive dysfunction is on this slide. What do I mean by reproductive dysfunction? Well, the most common form linked to insulin resistance is polycystic ovarian disease in women, which is clearly not only linked to it from a point of view of having associated increased risk of obesity and diabetes, but some of the therapies being used for women with polycystic ovarian disease are to relieve the insulin resistance with drugs like metformin, which have proven effects. Increased cancer risk is another association between obesity, insulin resistance, and type 2 diabetes. And this is true for a number of cancers, common cancers in both men and women, as is increased risk and increased progression rates for Alzheimer's disease, where now some people have referred to Alzheimer's disease as type 3 diabetes. And of course, all of this together comes together to impair longevity. And even in low experimental organisms like C. elegans, we know that altering insulin IGF signaling is one of the major ways we can promote longevity or shorten lifespan in these organisms. And as you will hear from the discussions this morning, and you heard just now from Jose as well, that these are generally regarded as all disorders in which there's an interaction between genes and environment. And we need to understand that interaction if we're going to make progress in reversing this epidemic. Now, I want to illustrate this, an important point for you with quick clinical slides from two studies, not from my work, but from other people's work. The first of these is a study now done over 30 years ago by Claude Bouchard, a famous Canadian obesity researcher, in which he took identical twins, put them in a clinical research unit for 100 days, and overfed them 1,000 calories per day, every day, 6 out of 7 days of the week for 100 days in a controlled setting of a clinical research unit. And what he published in this New England Journal article now, over 30 years ago, was that weight gain in twin A on one axis versus weight gain in twin B on the other axis shows a very strong correlation, leading to the conclusion that genetics are a very strong driver of the amount of weight you gain when given this high caloric challenge. But what he didn't point out, but I think is important for all of us to recognize, is that some twin pairs gained only 6 kilograms, while other twin pairs gained 14 kilograms, given the identical caloric challenge. So there is something inherently different among individuals here, leading to very different amounts of weight gain when given the identical caloric challenge. And this has to be compounded further with what happens with that weight gain with regard to diabetes and insulin resistance. So this study on the right side of your slide is shown from the work of Jerry Reven, who spent much of his career looking at insulin resistance in non-diabetic individuals using a technique called steady-state plasma glucose, where insulin resistance is higher on the vertical score as a function of BMI. And what this shows is that there's a very strong correlation between insulin resistance and BMI. But look at the spread of the data. At any given BMI, somebody can be very insulin sensitive and others can be very insulin resistant. So we have to understand what drives this different relationship in different individuals if we're going to do something about this syndrome. Now, over the last few decades, we've really begun to identify a number of these driving factors. And I'm just going to list them for you. I won't have time to talk about them. You've heard about genetics. You've heard some in these morning presentations about diet. And I think one thing that needs to be emphasized about diet is not just the quantity of the diet, but not just the quality, of the diet, but the quantity of the diet. We really need to remember calories do count, activity level, the gut microbiome that was raised by Griff in his introductory comments, fat type and distribution, and inflammation and metabolism as it affects us, because all of these are drivers in different ways of insulin resistance and the insulin resistance syndrome. And finally, I just want to end with a slide, and I'll just put it all up for you at once. Yeah. This slide is not designed to read you anything. It's a schematic, a simplified schematic of insulin action and some of the sites of insulin resistance that can occur. I had a few more in for it. And so I think that while we've made tremendous progress in the last decade unraveling many of these pathways, we still have a lot of work to do to figure out which pathways in which tissues at which time are important drivers of disease and which are important recipients of these signals. And hopefully with that kind of information, we will make impact on reversing this epidemic of diabetes and obesity. Thank you.